Okay, well, Patrick and I came down this evening to talk about a disease called Jaagsiekte, which is also known as OPA, and has been causing considerable concern in the Northern Ireland sheep flock for some time. So much so that it now accounts for nearly 4% of the total diagnosis of death that we see in our diagnostic veterinary laboratories in Stormont and in Omagh. And one of the problems with the Jaagsiekte is that it is very, very difficult to diagnose in the live animal. We are relying on flock health data, which allows us to highlight a higher than expected number of thin ewes, and we are relying on post-mortem data from the examination of animals to see the changes in their lungs associated with the tumours. We do not have a blood test to allow detection in the live animal. There has been research going on for 20 years nearly on development of blood tests, and as yet there is nothing that is suitable for diagnosis in the individual animal. And the latest thinking is that a technique called chest scanning or ultrasound scanning of the chest to detect the lung tumours in an earlier stage of development than has hitherto been possible has been perfected by Patrick Grant from Parklands Veterinary Group, and he can tell you a little bit about that just now.
With the emergence of chest scanning, it's given us a tool that we can try and minimise the damage done by Jaagsiekte and try and control it to the best extent we can within the flock scenario. The scan itself, we're going and we scan the non-wooled area non-wooled area under the leg, both sides of the ewe. It's painless for the ewe, takes a wee bit of labour maybe holding it, but it gives us an immediate diagnosis whether I'm seeing a positive case, or if there's a bit of pathology there that might potentially be the early evidence of Jaagsiekte, or potentially could be something like pneumonia. And I'll try and use it as a tool to sort of decide myself how I'm going to group the sheep, whether we're going to be looking at culling it or separating them out or return it to the normal ewe group. So it just enables us to manage it far better, and again it just gives farmers that wee bit of reassurance that there is something that we can use to control it.
And I think that when you have detected Jaagsiekte in your flock, be it by chest scanning or be it by a cull ewe screen or whatever, it's very important then that you manage it. Remember that the disease spreads very much from the ewe to the lamb in the early days of life, and possibly through colostrum too. And therefore, when you are culling out Jaagsiekte affected ewes, you should not keep their female progeny for breeding. So ewe lambs from Jaagsiekte affected ewes should be sent for fattening rather than retained for breeding.
Okay. I think it's a disease that's out there, so if you are buying in sheep from the ring or even privately, look, potentially there is, particularly over in Scotland, the north, that people are starting to scan the flocks, so you will see these scanned sheep for sale. And yes, there's still a risk with them, but at least it's a more minimised risk if people are scanning them pre-sale. Also, if you are buying them in, it is an option there to just scan them before they arrive in your flock as well, whether it be replacement ewes or at the very least your rams before coming to the flock, and trying to scan and even scanning them a couple of months later just to make sure that after the period of breeding that they're not starting to show any symptoms.